Dr. Surishetty Srinivas, can you please explain how our instructor will set a airway stations for demonstration during a CCLS training?
For CCLS training for airway station, we need this airway mannequin and two airway mannequin if possible. One for you and the same thing you have to do and the student has to demonstrate here. Okay, one airway mannequins and some other gadgets. One is the ambu bag, second is the Hudson mask, third, if it is possible, you keep a rebreathing mask and oropharyngeal airway, nasopharyngeal airway, eye gel and LMA and different size of tubes and working laryngoscope and some gadgets like boogie. Okay, so in CCLS what we will do, the patient is in a ward, we will receive a call so that patient is desaturating. So we can see the patient desaturating. First thing what you have to do, you have to give the oxygen support. You have to keep the mask, then you have to increase the oxygen up to the 15 liters. Okay, then you have to, so for 5 minutes you have to see the saturation is improving or not. If saturation is not improving, then you have to do the maneuvers. That is along with this one, along with the oxygen, you have to do the head tilt and chin lift maneuvers. Okay, so that the tongue will not come into the pathway of the airway. Then you have to, again you have to observe the saturation. If the saturations are not increasing, then you have to go for the gadgets. What next immediate gadgets is oropharyngeal airway or nasopharyngeal airway. If the patient is unconscious, we can use this oropharyngeal airway. So you have to tell the students how to measure the oropharyngeal airway and how to measure the nasopharyngeal airway also. Okay. Then how to insert this oropharyngeal airway. You have to go like this. After going that, you have to rotate like this and you have to push it. Okay. So you have to confirm. Then you have to keep it oxygen. So if oxygen is improving, okay. If it is not improving, and you have to remove this and you have to take the ambu bag for you connect the ambu bag, the oxygen supply, then you have to ventilate the patient. Ventilate the EC technique with, okay, so that you can see lungs are inflating or not by ventilating. Okay, in 30:2, what we will do? 30:2 scenario, 1001, 1002, 1003. That's enough. Or if you are giving 12 bars per minute, how you have to do? 1001, 1002, 1003, 1004, 1005. Again 1001, 1002, 1003, 1004, 1005. Or you can count as a for a 10 breaths per minute, you have to see that 1001, 1002, 1003, 1004, 1005, 1006, like that. Again 1001, 1002, 1003, 1004, 1005, 1006, like that. Okay. Then next gadget, if saturation is still not improving, next gadget is, if possible, both you can use the same purpose. Then next gadget is our supraglottic airways. Then how to hold the supraglottic airway, how to show the student. Okay, how to hold the supraglottic airway and how to pass it inside. Okay, how to pass it inside. I think it is too big, but take a very small size one. So you have to apply the jelly. You have to apply the jelly here and you have to pass it. Okay, this then you have to do the same here. Then 1001, 1002, 1003, 1004, 1005, 1006. Because it is a definite airway, 10 bars per minute you are giving. Okay, 1001, 1002, 1003, 1004, 1005, 1006. If still not is improving, if any senior is coming with you and he will help you so that he can intubate very fast, then you can take the help of senior and you have to intubate. And you have to tell the students how to intubate, what are the positions are intubate, what is the position during intubation, and how to fix the ET tube also. And you have to tell the students what is the use of this boogie also. Okay, and stillets, if possible, stillets also while intubating. So for basically for this CCLS airway station, two mannequins, this oxygen mask, ambu bag, oropharyngeal airway, nasopharyngeal airway, eye gel, LMA and endotracheal tube and working laryngoscope and stilling the 10cc syringe. We have to maintain, and we have to see that the student also tell the stepwise approach. First, you have to take the oxygen, then maneuvers, then followed by adjuncts like oropharyngeal and nasopharyngeal airways, then followed with supraglottic airways, then followed with intubation. These are sequence the student has to tell us. Thank you.
Thank you.